Hello, I'm Traci Brooks, Patient Care Coordinator here at the Veranda, and I'm here today to talk to you about chronic kidney disease. Chronic kidney disease is a process where the kidney function starts slowing down or not working as properly. What happens to our bodies when that happens? What's the result of that? The result is a buildup of waste and fluids in our body that is not supposed to be there. Our kidneys actually are filters, and they are to filter our blood, and they're to pull out the waste and byproducts, and then we excrete those through our urine. And different things happen to the body to let us know that the chronic kidney disease is beginning. What we are unfortunately seeing in the United States today is a huge increase of chronic kidney disease, and the number one cause of the chronic kidney disease that we're seeing today is diabetes. Because we have an influx of diabetes in our population, we are also seeing that influx of chronic kidney disease. What happens with chronic kidney disease? The best thing that can happen is for there to be early detection. So, as with anything else, you can, if you feel like you have any of the signs or symptoms, and let's just go over those real quick. The signs and symptoms of chronic kidney disease are you feel more tired and you have less energy. You have trouble concentrating, you have a poor appetite, you have trouble sleeping at night. You have muscle cramping, swelling in your feet and ankles, and puffiness around your eyes, especially in the morning. Sometimes I think, well, maybe I should check on that because of that one. Dry, itchy skin, and then also having to go to the bathroom more than once or twice in the nighttime. There is a blood test that you can have that is just a go-to that will let your provider know if you have any changes starting to take place with your kidney function. And it most of the times is done with your basic lab work that is done. But however, if you have any symptoms or signs that you're concerned about, or you're thinking that you may have something going on, then you can actually mention that to your provider. Now, there are some people that are going to be more prone or have the risk factors for chronic kidney disease. So what would those people be? Those people that are in the yellow light, they are in the warning signs. Those people are going to be your patients that have hypertension. So if they're hypertensive and have blood pressure issues, they could be starting with chronic kidney disease. That's something you should always be aware of. If you're diabetic, those people. If you have a family history of CKD, if you're older, those of us that are older, we're going to start seeing things happen to our bodies. That's just part of the aging process. If you belong to a population of people that have the high blood pressure and the diabetes, then you're going to have the chronic kidney disease. Like I said previously, the best thing about chronic kidney disease is early detection and trying to do things to change the course of that. The things that we talk about that's so important to do to the lifestyle changes to try to change the progression or to slow the progression of chronic kidney disease is we can, for diabetic patients, monitor your blood glucose. That's so important. For those of us that have hypertension problems, to monitor our blood pressure and try to keep our blood pressure under control. Dietary modifications. And in the dietary modifications for patients with chronic kidney disease, you want to, once again, avoid products with extra salt. If you're not aware, convenience foods, frozen dinners, frozen meals, canned soups, fast foods, all of the salty snacks, canned vegetables, processed meats and cheeses. Those all have the extra salt in them. And then also trying to choose lower potassium foods is important. Limit the amount of protein you eat. Also, if you're having problems with CKD or problems with your kidneys. High protein foods include red meat or lean meat, eggs, milk, cheese, beans. Low protein foods are going to be your vegetables, fruits, breads, and cereals.